Welcome back to 3+U. Well, sports, they are kicking up in high school. We've got soccer, we've got football, baseball going on, and with all of that comes the potential for injuries, and concussions are always a looming risk that parents and students and coaches worry about. Dr. Owen Speer is here. He is from CHI Memorial Hixson Primary Care. And Dr. Speer, concussion, first of all, define that for me. What is a concussion officially?
Well, a concussion is a form of mild traumatic brain injury. So someone might receive a bump on the head and then have symptoms afterwards more than just pain on the skull or wherever they got hit. It can also happen with a violent hit where you don't strike your head on the ground or anything, but afterwards you feel different. Symptoms might include a headache, feeling foggy, maybe someone looks kind of glassy-eyed and glazed over, and they're just not feeling right. That's usually the initial symptoms.
And I'm remembering the case of one actress, and I can't remember her name. She's married to Liam Neeson, but I can't remember her name. But she was skiing, fell, bumped her head, didn't really do anything about it, was fine. Later that night she died.
Yeah.
So is that a potential risk if you don't get checked out?
Well, certainly with any head injury, you can have the potential for more than just a basic bump on the head or even concussion. I think the worry is bleeding on the brain. So whenever an accident like that happens, it's appropriate to be worried and checked out if symptoms are more than just some mild headache or feeling bad. But yeah, sometimes you have injuries like that and they escalate. But more commonly, they're fairly mild but should be taken seriously.
So let's say that someone is involved in a mild concussion in whatever sporting related event they're in. Mild concussion, what does that mean later down the road?
I think in terms of concussions, we used to talk about them as mild, moderate, or severe. Nowadays, they kind of are all just categorized as a concussion if they're deemed so. And initially it can be hard to tell, but like I said, initially if there's an event that caused a head injury and the student or athlete feels different, looks different, they should be pulled from play and evaluated. And if they're not back to normal in terms of how they feel or performing, that's the person that needs to be evaluated for a concussion. It can be hard within minutes after the injury happens.
And is it possible that somebody's not exhibiting any signs of a concussion yet they still have one and they may manifest later?
Definitely, yeah. So it's wise to be cautious. If something happened and there's any signs of not feeling right, the person looks dazed or is feeling a headache or pain, they should be pulled from what activity they're doing and monitored. And
not that we don't have great coaches in this area that are really looking out for things like that, but if you're a parent, you want to take ownership of your child's health and safety. What do you recommend that they do to ensure that if their child does suffer a concussion, they're getting proper treatment?
Well, yeah, initially if they see their son or daughter acting differently than usual and they're not pulled out from play, they should talk to the coach to consider that. It's better to take a break early than to go back into play. There's a remote chance of what's called second impact syndrome, where if you already have a concussion and you take on another hit, it could be a lot worse or even result in death on the field. So we don't want that to happen. So ultimately, safety is best.
And doctor, a concussion, is it something that is going to be with you? I've often heard that if you get one concussion, it's a lot easier to get a concussion the second time. Is that true? And what's the deal with that? Why
it is true, especially if you have the concussion. It's kind of like a bruise on the brain, and initially if you're having severe symptoms, you may go to the ER, and that student or person might be evaluated with a head CT, and there's really going to be no changes on that, and even an MRI of the brain, you're not going to see any changes. But the brain is considered damaged or bruised in a sense. It needs time to heal, and initially you might have sensitivity to sound or light. It's going to be really difficult to concentrate, reading, watching TV, so those activities should be avoided initially, and then slowly increase those activities if they don't make all your symptoms worse. And for kids, school can be a challenge, so they have to be careful about about getting back into school full time. They may need to take extra time for their classes or breaks during the day so they don't feel worse. And once they feel normal and are functioning well, then they can return back to sport. Usually getting back into exercise and sport is the last thing.
And other than just telling kids, don't bump your head, is there anything preventative that you would recommend to coaches, to parents, to make sure that they're being as safe as they can, that they can avoid concussions unnecessarily?
In terms of youth football and youth sports, they talk about a heads-up approach rather than going in for a tackle heads down. You want to look up, and that minimizes the injury to the head and neck. But basically, any sport with any sort of contact has the potential for it. So, and the protective gear like helmets really just prevent damage to the skull itself and don't really protect against concussion.
Really?
Yeah. So
I think that's going to surprise a lot of people. So it doesn't protect against concussion.
Not necessarily.
Is the concussion more, instead of smacking the head, is it more just kind of the rattling or jarring that does the damage?
Rattling, jarring, and kind of a shear force. And if that head or neck gets hit and there's a twisting motion, that brain inside the skull can move around, and that results in all the symptoms of feeling bad as a result of the trauma.
Telling you, keep your kids safe. If there are any questions that you want, I would recommend you get in touch with Dr. Owen Speer, CHI Memorial Hixson Primary Care. There's a phone number you can call, 877-1249, 877-1249. And I'm sure there's lots of information on the website. You can Google that out on Hamill Road. Thank you so much, Doctor. I appreciate you coming by. And we will have him in every month to talk about issues just like this. We're back, more 3 Plus U right after this.